the same relief to working families. That's wrong. That's not fair. Ordinary Americans deserve the same exemption that the President has given businesses. Let's reopen this government. Let's reopen it fairly. I yield back.
The gentlewoman yields back. The chair recognizes the gentlewoman from the Virgin Islands, Ms. Christensen, for 5 minutes.
Thank you, Mr. Speaker. Mr. Speaker, Tuesday was a bittersweet day. It was an unfortunate day because of the government shutdown, but it was a good day because of the millions of Americans who live in the states and Washington, D.C., who finally had the opportunity to leave the ranks of the uninsured when they logged in or called the toll-free number and enrolled in affordable, quality health care coverage through the health insurance marketplaces. However, October 1 was bittersweet for other reasons for me, and I rise today as a congresswoman from the United States Virgin Islands because on October 1st, my constituents, who are also Americans, were largely left out in the cold on this key part of the law. As a member of the Health Subcommittee on Energy and Commerce, I was at the table and an active participant in the drafting, negotiations, and amending of the Affordable Care Act. And I'm proud that I was. But it was and remains sadly clear that one of the U.S. Virgin Islands and the other territories' biggest public health and health care challenge when it comes to federal policy is benign neglect. Despite our efforts, still too many people, well-intentioned, just don't acknowledge that, for example, across nearly every health indicator, from HIV/AIDS, cancer, heart disease, and obesity prevalence to rates of uninsurance and health care provider shortages, the U.S. Virgin Islands often is worse off than the national average. And so I, working in close collaboration with leadership in my U.S. and my territorial colleagues, the Black, Hispanic, Asian, and Progressive caucuses, worked tirelessly to ensure that the more than 4 million Americans who live in U.S. territories, as well as our collective health care systems, would enjoy the positive benefits of health care reform. The great news is that we were in very large part successful. Today, Virgin Islanders, like other persons in the territories, are included in the consumer protections that make it illegal for a health plan to deny health coverage because of a pre-existing disease or to rescind or deny coverage when someone gets sick, and to impose lifetime dollar limits on essential benefits. Today, U.S. Virgin Islanders can keep their children on their health plans until that child is 26 years of age. Because of the Affordable Care Act, today seniors in the U.S. Virgin Islands receive free annual wellness visits, free preventive care. They've received Medicare prescription drug rebate checks and meaningful help covering the cost of their prescription drugs. In the U.S. Virgin Islands, because of the Affordable Care Act, our community health centers and community health workers are strengthened and better equipped to serve as medical homes. But the devil is in the details. You see, the sad reality is that just because U.S. Virgin Islanders are included in the law and eligible for these great benefits does not mean that the law has been implemented in a manner that allows them all benefits or to fully experience the positive impact that the Affordable Care Act was intended to have on every American. The law gave the governor in the U.S. Virgin Islands a choice between two options in all of the territories. One, to establish a health insurance exchange, either separately or in partnership with a state that was also setting up a state-based exchange, or two, to use the funds that would have gone towards the exchange to expand our Medicaid program. The governor, based on advice of a task force and consultants, opted for option number 2. And so amid all of the information that is being promulgated about the opening up and the enrollment of the exchanges, wonderful news for many Americans, my constituents and those in the other territories feel very much left out and unfairly treated. To add insult to injury, there are no individual policies being written, and the industry is blaming it, I think, unfairly and not rightly on the Affordable Care Act. It's important to remember that because of the Affordable Care Act, there's a very significant increase, though, in the hundreds of millions of dollars in funding for the Medicaid program, and that the governor can establish a local poverty level that could significantly increase Medicaid eligibility. The robust increase in funding for Medicaid can allow for thousands of Virgin Islanders to be newly eligible for meaningful health insurance coverage under that program. Unfortunately, though, the House passed provision that would have changed the match did not make it through the Senate, so the match is set so high that it's difficult for us and the other territories to fully utilize the increased funding. As a physician who practiced for more than 20 years before coming to Congress, I know what happens when someone's health and wellness, as well as personal finances, when they do not have health insurance coverage. It's catastrophic. That's why I've requested meetings with Secretary Sebelius to explore how and whether the monies that could have been used to establish a health insurance exchange can instead be used to making health care reform a reality for those who are uninsured but make too much to qualify for Medicaid. So there's a small but distinct window of opportunity to work with the Secretary and our Governor to think outside of the box, to identify meaningful and thoughtful solutions to the unique health care challenges facing the Americans in the U.S. Virgin Islands. Some will require legislation. I ask for the support of my colleagues on that. But also, please let us pass a clean CR to keep our government open and providing services to all Americans wherever we live in this great country. Thank you. I yield back.
The gentlewoman's time has expired. The chair recognizes the gentleman from South Carolina, Mr. Sanford, for 5 minutes.
Mr. Speaker, I thank you. I've been a runner all my life. I ran in high school and college, and it's always been my way of sort of clearing my head. Sometimes I clearly haven't run enough. And over the years, during my roughly 20 years in and out of Washington, I have made it a tradition of running down the mall, down to Lincoln Memorial. And I have been down at the Lincoln Memorial on those runs in the dead of night when there was not a soul down there. I've been down there at sunrise when there was nobody there. I've been there in the summer afternoon when it seemed like every tourist from this country and every tourist from around this world was gathered there. But yesterday, I went for an evening run after votes, and I saw something I've never seen before. Because as I ran down the mall, I got to the World War II Memorial, and it was chained up. Now, mind you, this is an open-air rock memorial dedicated to the sacrifice of so many soldiers there in World War II, an open-air rock memorial. But I continued on with my run, and I got down to the Lincoln Memorial, and to my amazement, that thing was chained up too. I was so agitated in seeing this that I turned to a tourist, and I said, "You got to be kidding me. Would you take a picture of that?" And it was actually a family from Shanghai, China, here halfway around the world. They took the picture and they emailed it to me last night, and it's an amazing shot. As you can see there, the Lincoln Memorial, 2 guards. Now, mind you, I've been there many times when nobody was there. No security guard, nobody. And yet in this instance, you have chains around it, 2 police guards, simply to keep people out of one of the great memorials to freedom in our country. And it just strikes me that that is a picture of political gamesmanship and hostage-taking. And I would say respectfully, Mr. President, you've gone too far on this one. You know, at the time of the sequester, you ended school tours to the White House. Now, mind you, not since Jefferson's time and war has the People's House, the White House, been shut down for public tours. But you use that as a political tool somehow to gain advantage in the sequester that still exists. So kids from 8th grade may take their one trip to Washington, D.C. and can't go to the White House because you think it'll gain political favor. And I see the same thing going on with this. And so let's agree that we disagree. We agree that we ought to be, we as Republicans think we ought to spend less. You and Harry Reid think we ought to be spending more. I think the congressional budget numbers are on our side. They say that in just 12 years we're only going to have enough money to pay for interest and entitlements and nothing else. And in that regard, this is just a sneak preview of much more damaging things to come if we don't get our financial house in order. But I would say it is okay to have disagreements, but it is not okay to hold, I guess, citizens hostage in trying to maximize and inflict pain in their ability to do normal things, particularly when the House has offered 4 different bites at the apple in keeping the government open, and particularly when just last night bills were sent to Harry Reid that would have kept government open, would have kept the Park Service open, would have kept groups like NIH open. I think that this is really important. Reagan once said there at the Brandenburg Gates to Mr. Gorbachev, tear down this wall. And I would say to you, Mr. President, take down the chains. take down the walls to these open-air memorials to freedom. This is not the National Archives where things could be taken or stolen. These are open-air memorials. This is ridiculous political gamesmanship. I was governor for 8 years. I have been an executive. I know that you can do this, and I would ask that you do so. I'm going to go for my evening run, 5:30, 6 o'clock. I would invite every one of y'all up there in the gallery, come join me at the Lincoln Memorial. I would ask listeners out there to join to the Lincoln Memorial. I'll talk to Representative Palazzo from Mississippi and Michelle Bachmann and others who gathered there at the World War II Memorial. This has gotten out of control with regard to this degree of political gamesmanship by Harry Reid and by the President. And so I would just ask that you take another look at that picture. Think about what it means. Think about the sacrifice that's been made that is ultimately about what these memorials are founded on. And why can't we do something about it, Mr. President? I would ask you to do so. I'd yield back the balance of my time, and I'd invite folks for a 5:30, 6 o'clock run down at the Lincoln Memorial. Thanks so much. Appreciate it.
Gentleman yields back. The chair reminds the members that they are to direct their remarks to the chair. The chair recognizes the gentleman from California, Mr. Acosta, for 5 minutes.
Thank you very much, Mr. Speaker. I'd like unanimous consent to advise and extend my remarks.
Without objection.
Mr. Speaker, we have seen a great deal of political posturing and speeches over the last several days. I think it's time that we get our priorities straight and pass a clean budget that reopens this government. I think the American public is frankly sick and tired of the blame game. I also believe that many of my Republican friends are distracted with issues that are important but are not central to the question of funding government. We can debate the issue of the Affordable Health Care Act as we should, but it's not central to reopening government. Today I'd like to talk to you about two public servants from my neck of the woods, the San Joaquin Valley, who put their community first and delivered results. Sadly, in the last week, these two individuals have passed away, and we say goodbye to them. But I want to use their examples as role models because I think their commitment to public service to the people of the San Joaquin Valley in California and our nation are a good example. One was a Democrat, one was a Republican. Both were widely respected, and they never ever let partisanship or ideology get in the way of solutions. George Zinovich and Pete Mijas were the best our valley had to offer, especially on how they conducted their lives. Pete Mijas, from a Greek immigrant family, was a pillar of an education community in the valley for almost 50 years. From the time he entered the classroom in 1963, he was bound for leadership and to change the lives of countless individuals. He realized the special challenges of students in our valley and throughout the state, and he made their voices heard. His passion was recognized by Governor George Deukmejian, who appointed him as Chief Advisor on Education, relating to all matters involving education. Pete served also under Governor Pete Wilson and Governor Arnold Schwarzenegger, and ultimately President George Bush when he was appointed to the Advisory Commission on Education of Excellence for all Americans. Knowing that strong schools require strong communities, Pete wanted to see Fresno prosper and develop into a thriving business hub. From the co-founding leadership from Fresno, sitting on the Valley Business Conference, the Executive Board as the President, and also the Fresno County Athletic Hall of Fame, where he was enshrined, Pete invested his time for the community and the city he loved. For 16 years, he was served as the superintendent of Fresno County Schools, where he represented 34 school districts, 325 schools, and almost 200,000 students. He was a loving husband, a proud father, and a distinguished alumni of Fresno State. He was part of the 1961 Mercy Bowl team that was a national champion. So with a heavy heart that we say goodbye to this man who dedicated his life to making the future of others brighter. Another individual who he worked with and who I worked with was also a pillar of our community, and that was George Zinovich. George was a man who lived his life with purpose and dedication to public service. Born in 1922 from a Slavic family, He was a proud product. He served in the United States Army Air Force. He was student body president at Fresno State. And later on, he enrolled in law school after he married the love of his life, Kika. Upon completion of his degree, he quickly built a strong professional representation and served in the California Assembly beginning in 1962. Later on, he became the majority leader before taking a seat in the California State Senate. His impact as a senator was far-reaching, from creating the California Arts Council, the California Housing Authority, Finance Agency, to authoring the first law in the United States that gave farm workers a chance to collective bargaining through the Agriculture Labor Relations Board. He was an advocate for those voices who sometimes got lost in the political banter. In 1979, George was appointed by Governor Jerry Brown to be on the Court of Appeals. In 2008, Fresno's new 5th District Court of Appeals building was named after him, the George Zinovich Court of Appeals building, for his lifetime practice of fair and sound jurisprudence. George was a shining example of what a public service should be, and never lost sight of those in the community he served. Both of these people put their community first. I worked with both George and Pete for years, and they were not only my friends, but they were friends of the valley they loved and the state they called home, California. My colleagues, Mr. Speaker, I think it's time for all of us in this body to live up to the memory of these two shining examples, people who we have all worked with throughout our lives. And I think in the true tradition of public service, these are the kind of individuals we ought to be role models when fixing our nation's budget and putting government back to work. I yield back the balance of my time.
The gentleman's time has expired. The chair recognizes the gentleman from Washington, Mr. Hastings, for 5 minutes.
Thank you, Mr. Speaker. And Mr. Speaker, yesterday the House passed and sent to the Senate a bipartisan bill to keep our national parks open. 23 Democrats joined the House Republicans to end the closure of these national treasures. They joined us to unlock the gates and to open the doors of these treasures from Acadia to Zion. They joined with us to tear down the barriers and erected to block access to our open D.C. memorials that my colleague from South Carolina just alluded to a moment ago. These memorials are open 24 hours a day, 365 days a year. So the Senate should act today to pass this bill and to send it to the President for his signature. But it's disappointing to see statements from Senate Democrat leaders dismissing and even ridiculing these common sense steps as piecemeal. It's even more disappointing that the President has threatened a veto of this bill to keep the parks open. But, Mr. Speaker, let's not forget that 1 week ago today, the Senate Democrats, led by Harry Reid, and the entire Senate unanimously approved a bill to keep the Federal Helium Reserve open and operating. And last night, the President finally signed this bill to prevent a helium shutdown into law. Now, make no mistake, Mr. Speaker, I am glad the Senate unanimously passed it, and I'm glad that the President signed the law. It's important for our economy. But the reason I bring this up is that the helium program is part of the Department of Interior, the Department of Interior that is responsible for our national parks. So one has to ask, why will the Senate pass and the President sign into law a bill to specifically prevent the closure of our federal helium program, but then refuse to act on a bill that would end the closure of over 400 national parks that are visited by millions of Americans every year? The contradictions in their words and actions are glaring. Such political posturing is not only illogical and hypocritical, but the result of that posturing punishes the American people. Mr. Speaker, this does not need to happen, and it should not happen. So I urge the Senate Democrats and the President to stop going out of their way to make the government shutdown as painful as possible. And I urge the Senate Democrats and the President to come to the table and negotiate an end to this shutdown, and to act today to take the reasonable and responsible step of passing a bill to open our parks and memorials to Americans' veterans, families, and all U.S. citizens. And with that, Mr. Speaker, I yield back the balance of my time.
The gentleman yields back. The chair recognizes the gentleman from Illinois, Mr. Davis, for 5 minutes.
Thank you very much, Mr. Speaker. And I come to the floor today to express condolences to the families, friends, and parishioners of Bishop Rayford Bell, who passed away this past Sunday while preaching a sermon in his pulpit. As a matter of fact, his wife had suggested that he not go to church, but he indicated that he would go because he thought it might make him feel better. He was 90 years old, grew up the son of a sharecropper in Mississippi, moved to Illinois, founded several schools and colleges, became the senior bishop of a diocese, well loved, well respected, a tremendous personality. I came to know his family when I taught his nephew 40 years ago and have observed him ever since. Just wanted to say to his family, friends, and parishioners that they have been graced by the presence of a tremendously great individual who died doing what he liked to do, and that is preach the gospel. And I yield back the balance of my time.
The gentleman yields back. The chair recognizes the gentleman from Georgia, Mr. Westmoreland, for 5 minutes.
Thank you, Mr. Speaker. Every day now for the past 3 years, I've heard from the good people of Georgia's 3rd Congressional District about how expensive their health insurance costs have become and will become as a result of Obamacare. On Tuesday, their fears of just how unaffordable this Affordable Care Act is became a truly bleak reality to them. If this train wreck of a law is really affordable, then why have Georgians seen their premiums increase by as much as 300% on the exchange? If it is affordable, why do 57% of Americans oppose Obamacare? If this law is affordable, then why is Ruth from LaGrange opting to pay the penalty and forego insurance because she and her husband can no longer afford to pay their family's premiums under this Affordable Health Care Act? I guess even if Ruth likes her plan, she really can't keep it. She was lied to. One thing supporters of Obamacare always tout is that it will help those who are very sick or have pre-existing conditions get access to affordable care. Well, let me tell you about Cindy from Noonan, who is fighting a brave battle with cancer. Much to her surprise, she has been told by her doctor that under the Affordable Care Act, Obamacare, some of the treatments and medicines that make a difference in her being sick just a few days instead of a few weeks will no longer be covered. What about someone who does not have a few weeks? What are they supposed to do, and how do we explain that to Cindy's children? You know, it's a sad day when employers like IBM are left with no choice but to kick retirees off their health care plans. What a reward to those like David of Griffin, who have given so many years contributing to their company's success. And it's not just hurting American families, it's killing small businesses, the economic engine of our country. I just got a letter from Dale in LaGrange, who is one of 4 owners of a heating and air conditioning company which self-insures their employees. In an effort to comply with Obamacare, Affordable Care Act in 2011, the heating and air conditioning company saw their health care costs go up $38,000 compared to 2010. The same thing happened in 2012. Their costs went up almost $40,000 from 2011. This means they went from spending $115,000 on health care for their employees in 2010 to almost $195,000 just 2 years later. What's just as concerning is employers who have been forced by Obamacare to increase their employees' premiums and no longer offer health insurance for spouses or children. This change has been a financial disaster for Melanie of Hamilton, whose husband will no longer be covered by her employer, TISA Systems, a great company in my district and a stable source of jobs. In 3 years, we have seen the disastrous consequences of this supposedly Affordable Care Act, and in just 3 days since the changes have gone live, we have heard hundreds of stories similar to the ones I just told. Imagine how much worse things can become in the 3 months. But listen, it's not just the lies that we have been told, but it's the lies we're still being told, such as California reported they had 5 million hits. But finally today they confessed they only had 655,000. As I've said time and time again, the easy solution here is for the President and my colleagues on the other side of the aisle is to join House Republicans and agree to a 1-year delay in the fund. Just like he's done a delay for big business and his buddies. Why don't we do it for the American people? Why don't we put all of us in the same class rather than trying to divide this country? Why don't we do the delay? Give them time if they can to straighten out this mess, but put everybody, small business, Americans, everybody, employed and unemployed, on their own system. Mr. Speaker, I yield back to balance my time.
The gentleman yields back. The chair recognizes the gentleman from Michigan, Mr. Kildee, for 5 minutes.
Thank you, Mr. Chair. Now, I was sitting and listening to some of the previous speakers, and I heard more than one, but one in particular, make the point really forcefully that nobody wants this government shutdown, that universally we oppose, as members of Congress, keeping our government closed. I just wish that were true. I've been doing a lot of reading on this and looked back at some of the reports from months ago. Really interesting story in a magazine recently that described a strategy to not adopt the budget and to force an argument over the continuing resolution and to force a debate over the Affordable Care Act into the debate about the continuing resolution, with the idea that if we don't here in Congress capitulate on a previously enacted law that the House and the Senate agreed to, that the President signed and the Supreme Court upheld, if we don't capitulate, that there'll be a shutdown of the government. So I only wish it were true that not everybody in this body wanted to avoid this shutdown that is crippling our economy and hurting the American people. There is something that we can do, however, to get out of this, and it would be simply to allow for a dose of democracy in the House of Representatives, because we know, and I've talked to many members on both sides of the aisle, but particularly members on the other side, and it's not just the 17 that have already declared their willingness to buck the Tea Party leadership and essentially the leader of the group in the House is a senator from Texas. More than just 17 are willing to vote for a clean bill to reopen government so that we can get back to the business of legislating. I think it's a big number, and I would suspect that it might even be a majority of the other side. The Senate would approve it. It already has. The President said he would sign it, and a majority of this House, probably a majority of both parties, would approve a clean resolution to reopen government so that we can get on with the fights about the things that we don't agree on. That's the way this democracy was designed. Now, I'm new here. Only been here 9 months, but I've been following government, been a part of it for a long, long time, a citizen who understands how our democracy is supposed to work. And I always believed that if a majority of both bodies agree on a particular position and the President agrees, that we can put a law through, sign it, and get on with the business. The other side talks a lot about negotiating, having a conference committee. It is so interesting to me that back in April, after both bodies, the House and the Senate, had adopted budget resolutions, that it was the Republican leadership who not only failed to, but refused to negotiate a budget resolution that could have avoided this whole thing in the first place. And I had to wonder then, I was scratching my head, why? The charade of the last week or so has made it clear to me why. This was the intent all along, to shut down government and use that. The kindest term I could use, I suppose, is leverage. I've heard others use other terms. But to use that leverage to try to extract from the government that which the other side couldn't win legislatively, couldn't win at the ballot box, but will use every tool, including the closing of the federal government and now the threat to default on our federal obligations and wreck the economy in doing so. The President agrees, the Senate agrees, the majority of the House agrees. We should continue to operate government. We should adopt the continuing resolution at the number that the Republican leadership has supported all along and get back to providing the services that our country needs and provide stability back into our economy. Mr. Chairman, I yield back.
The gentleman yields back. The chair recognizes the gentleman from North Carolina, Mr. Pittenger, for 5 minutes.
Thank you, Mr. Speaker. Mr. Speaker, I was frankly disappointed, really perplexed yesterday when the President of the United States called a meeting in the White House and asked the Speaker of the House to come to meet, asked the leader of the Democrat in the House to come and meet, asked the majority leader in the Senate to meet. At the same time, his press man, Jay Carney, was on TV saying, you know, we're not going to negotiate. When they ended the meeting, Senator Reid, Ms. Pelosi said, we're not going to negotiate. You know, Mr. Speaker, I'm aware that this bill has been 50 years in the making. The Democrats have wanted to nationalize health care for 50 years. They found their political timing to do it when they controlled the House and the Senate, when President Obama was president, and with a total partisan vote, they got what they wanted. Not even reading the bill. As Ms. Pelosi said, we're going to pass it, then we're going to read it. Yet Mr. Obama has said that House Republicans are on an ideological crusade, Mr. Speaker. His staff have referred to us as suicide bombers. Really? You know, Mr. Speaker, we were all elected to serve our constituents. The President was, and so was I. So was the Speaker of the House. We don't have a monarch in this country, Mr. Speaker. We have a representative government. And our role is to listen and to respond to our constituents. They are writing us. They're emailing us constantly, telling us their concerns. Let's hear about one from Cornelius, North Carolina. I just received my new monthly premium from Blue Cross Blue Shield of North Carolina for 2014. With the Obamacare monthly cost now has tripled with more limited coverage. But what the heck? Now I can get pregnant at 58 years old, and I can, because I have my mandatory maternity coverage. Please continue to push to stop this horrible mandate. Here's another constituent from Huntersville, North Carolina. We're currently paying $270 a month for our high-deductible health insurance policy through Blue Cross Blue Shield. Today, however, we received our new rate for our family. For 2014, a comparable plan now with Blue Cross Blue Shield is $1,037.02. Mr. Speaker, this is deplorable. She goes on to write, it is my understanding that under Obamacare, premiums would go down. It was my understanding that this would be good for everyone. If Obamacare is not good enough for government employees, like members of Congress and the White House, why is it being delayed for certain corporations and labor unions are asking for an exemption? And why can't I get out of this program? She goes on to write, I'm asking you to stand up for freedom, for choice, for the citizens of this country, to delay Obamacare for at least a year, at the very minimum, or even better, to repeal the law in its entirety. Mr. Speaker, this is not an ideological crusade. This is about meeting the needs of our constituents. There are other concerns out there with jobs. Companies aren't hiring full-time people. They're hiring part-time so they can stay under that threshold. The cost of this health care plan has gone up dramatically. The CBO, the Congressional Budget Office, says it's unsustainable. Why should we allow for corporations, there's 1,100 of them today, friends of the President, to receive a delay in Obamacare? And yet, ordinary Americans cannot do that. That's why we proposed an amendment for an for individual mandate deferment, that they would not have to be obligated at this time. We also said that members of Congress should not receive the subsidy, nor should the White House staff, the President, his cabinet secretaries. Why should we get something special that the ordinary American people don't get? And yet these bills are lying on the desk of Harry Reid because he tabled them. Mr. Speaker, it is time to bring sound reasoning to this process. Let's meet and negotiate, Mr. President and Senator Reid. Thank you.
The gentleman's time has expired. The chair recognizes the gentleman from Kentucky, Mr. Barr, for 5 minutes.
Thank you, Mr. Speaker. Mr. Speaker, the American people are frustrated and angry that politicians in Washington can't even work together to keep the government open and operating. They're hearing a lot of rhetoric from the White House and Congress about who is to blame. But instead of trading accusations about who is to blame, the President and Congress should face the realities of divided government. The only way forward in divided government, when there is a difference of opinion, when there is an impasse, is negotiation and compromise. I come from the same congressional district that was once represented by Henry Clay, a great statesman and Speaker of the House. Clay, who was known as the Great Compromiser, knew that in divided government the only way forward is through negotiation and compromise. Unfortunately, the President and the Senate Majority Leader continue to reject the model of Henry Clay. They continue to say that they will refuse to negotiate, refuse to compromise, refuse to work in a bipartisan way to achieve a middle ground and end this government shutdown. Last night, the President hosted congressional leaders at the White House. But rather than offer to negotiate about how to reopen the government and fix some of the harmful effects of Obamacare, the President reiterated his stubborn refusal to negotiate. Regrettably, the meeting was more political theater than a genuine effort to resolve this impasse. In contrast, this House has offered to negotiate. The House has offered multiple compromises. Since September 20th, the House has voted no less than 14 times to fund the government, to fund critical parts of the government, to fund the District of Columbia, to fund the National Institutes of Health, to fund our national parks, to fund our troops, to fund our veterans, and to end this government shutdown. But instead of working with House Republicans to reopen the government, this administration directed barricades to be placed at the World War II Memorial, inconveniencing our honor flight veterans visiting our nation's capital. Instead of working with House Republicans to end the interruption of life-saving clinical trials for cancer patients through the NIH, the Senate Majority Leader asked, why would we want to do that? Our friends on the other side of the aisle say they want to vote on a so-called clean CR. They insist that we ignore the voices of millions of our constituents who are flooding our offices with calls asking for protection from Obamacare. But the truth is this: the House has compromised over and over and over again. And the only demand that this House is making to the President and this Senate is that if you insist on Obamacare, if you refuse to delay this law or fix its harmful features, then at least do away with your special deal. At least give up your special exemption and your special perk under this law. At least join with House Republicans in requiring all politicians in Washington, the President, members of the Cabinet, members of Congress and their staff, to live under the same health care law that they have imposed on the American people. At least live by the laws you write. Mr. Speaker, let me conclude by asking my colleagues on the other side of the aisle a simple question. If Obamacare is such a great program for the American people, if it is so worth defending that you're willing to shut down the government to defend it, then why won't you participate in it? Think about it. If Obamacare's exchanges are such a perfect solution to the problems of health care in our nation, then why are Democrats in the White House and in Congress so intent on keeping their special exemption from them? Mr. Speaker, it is wrong for politicians in Washington to shut down the government and vote against every bill to reopen the government just to keep their special deal that no other American gets under Obamacare. So I call on the President and the Senate to end their stubborn refusal to negotiate, end their stubborn refusal to compromise, end their stubborn refusal to open this government just so that they can keep their special exemption under Obamacare. Mr. Speaker, I say that if Obamacare is such a great law for the American people, then it should be good enough for President Obama and members of Congress. I yield back.
The chair will receive a message.
Mr. Speaker, a message from the Senate.
Mr. Speaker,
Madam Secretary.
I have been directed by the Senate to inform the House that the Senate has passed H.R. 3233 to extend the period during which Iraqis who were employed by the United States government in Iraq may be granted a special immigration status.
The chair recognizes the gentlewoman from New York, Ms. Maloney, for 5 minutes.
Mr. Speaker, it's important to look at the impact of the shutdown and a looming government default on our financial markets. On the shutdown, if the SEC uses all of its rainy day money, it will be forced to close some key market oversight functions. There would be little to no oversight of exchanges, and if there were more trading glitches like the one that closed down NASDAQ last month, the SEC wouldn't be able to respond quickly, and problems could quickly spiral out of control. This could irreparably damage confidence in the safety and integrity of U.S. financial markets. And I've always said that markets run more on confidence than on capital. On the debt ceiling, defaulting on Treasury bonds could be truly catastrophic. The assumption that Treasury bonds are risk-free is the most fundamental assumption in the financial markets. It underpins the entire world's bond market. If Congress doesn't lift the debt ceiling and we default, Treasury bonds would, for the first time in our history, no longer be risk-free. The value of bonds around the world would instantly fall, and billions of dollars of wealth would be destroyed in the blink of an eye. The dollar could even lose its status as the world's reserve currency. We need to end the shutdown and lift the debt ceiling today. Jobs, growth, and the financial security of our country depends on it. I yield back the balance of my time.
The gentlewoman yields back. The chair recognizes the gentleman from Maryland, Mr. Sarbanes, for 2 minutes.
We beseech the Speaker of this House, John Boehner, to bring a clean budget to the floor. That is the responsible thing to do. It is the democratic thing to do. Unfortunately, in a cynical power play that only serves to further inflame the wrath of the American people, the Speaker has erected a wall of obstructionism, a wall that in truth is separating the American people from their democracy. So we say today to the Speaker, Mr. Speaker, open these gates of democracy. Mr. Boehner, tear down this wall. Tear down this wall of obstructionism. Tear down this wall that has been constructed on a foundation of reckless ideology. Tear down this wall of shame upon which the most extreme members of your caucus have so proudly, almost gleefully, inscribed their names in mockery of the will of the American people. Tear down this wall of obstructionism. Show that democracy can indeed flourish in this chamber. Bring a clean budget to the floor. Today, bring it to the floor. It will pass, and we can put our government back to work. I yield back.
The gentleman yields back. Members are reminded to direct their remarks to the chair. Pursuant to Clause 12A of Rule 1, the chair declares the House in recess for a period less than 15 minutes.
And so as the House takes a very short 10-minute break, we're going to use this opportunity to get your